at night? Not. So what would be benefit of progesterone? What happened when we go after 50? And I think everybody's here after 50, right? You have insomnia, right? Progesterone turns into GABA-like metabolites and give you that deep night's sleep. You have patients have problem with insomnia? We treat patients who use all the drugs and fail, and when we give them intranasal progesterone, including Dr. Joseph himself, you will have a night's sleep. What other thing progesterone does? It stimulates the expression of nitric oxide synthase. It's good for blood pressure. Is that what happened? The metabolic syndrome, high blood pressure? What other things it does, progesterone? It inhibits the conversion of testosterone to estrogens, right? That's a good thing that we want. What other things it does? It's express antioxidants. And so I think progesterone, intranasal at night, iodide in the morning, right? When you wake up to 10 milligram iodide, not potassium iodine. That is something we will do for everybody above 50. Okay, what other things do you need to give them patients?
You mentioned cyclodextrin. Was that intranasal?
Intranasal loaded progesterone, you load inside cyclodextrin. And that's a compounding pharmacy can do it for you. And then you give them iodine in the morning, right? So now we're able to feed the sex hormone, prevent that switch from happening, prevent the estrogens, the cancer, the culprit, the inflammation, right? What we need to do after 50, what's the other problem they have? Obesity, getting overweight, right? They have problem with the oxytocin.
Atherosclerosis.
Yes, atherosclerosis, the cyclodextrin will take care of it. You know, the best treatment for excess of cholesterol and clearing up the blood vessels. What is the best treatment right now? Is it statin? Is it fibrate? It's cyclodextrin. Okay? So intranasal progesterone, what it does?
It pulls the cholesterol right out of
From your blood
Actually, a
vessels.
better way to see it, it behaves very much like HDL.
Right.
That's the best way I can describe
And more, because it also clears the body from mycotoxin. And do you have anything that you know before that clears the mycotoxins? Detox the mycotoxin? No. Cyclodextrin is the one. Okay? So what other things we need to do? We need to give the patient oxytocin in the morning, right? Because what would happen after 50? Oxytocin drops too, along with 6 hormone. And oxytocin, what is it? It helps to reset the whole physiological process of your body. But the problem why oxytocin is not, in the mainstream, or we don't hear about it, and they did it intranasal, because they did not load it with cyclodextrin. When you load the cyclodextrin and you prevent it from being degraded, and you get it intranasal, you will get the effect of it. You will feel it. Especially Dr. Joseph, sometimes he injected loaded cyclodextrin particle, injected, and he feels the euphoria. But oxytocin is like a computer when it crashes. What you do? Reset factory, right? Oxytocin is a reset factory drug for our body. If you see some of the videos of a guy of age of 80, and he's on the can, right? It's age of 80 or 90, maybe 90. And then they open the music, right? And then see his old pain and arthritis, and with 2 cans, not just one. And then with the music, what will happen? He throw those cans, and he start dancing, no feeling pain. Why? Because of oxytocin, right? Those people, they see them in church and all that stuff, in the mosque and all that. They feel in the concert, they feel good. The music increases oxytocin, right? And it's helped to heal people, right? Okay.
Can I make a comment?
Yeah.
So this is just an example, and what I like most, it's an example of, again, how to think about it, how to think about, have these conceptual models, and how they all affect each other, and how to use these innovative ways of doing things to know that you're addressing all of the major issues to guide the thinking. So it's how we think about it. And just like the lecture before, when you talked about the bugs being something that has to be addressed, that's a way of thinking about it, because in my opinion, there's always a reason. If you don't know, it's because we didn't dig deep enough and read between the lines and find the true reason of what's going on.
Dr. Rowan, go ahead. Thank you. You mentioned intranasal progesterone for MS. What about other neurological degeneration like Parkinson's or Alzheimer's?
I think progesterone will help all of them. Anything, there is, all those degenerative diseases, they have some sort of inflammation, and microglia is active. All right, whether it is Parkinson, whether it is, and that's the reason you know Parkinson's disease that manifests after maybe 80% of the neurons are dead, but that's the wrong term. They're not dead, all of them. It may be 50, but the rest are stunned by inflammation, right? Did you see the video of a doctor who puts IV glutathione and Parkinson is improved? Have you seen that? Dr. Davis, I think, neurologist. Okay, so why is that? What happened? Anybody can explain here?
Cut down the inflammation and the damage in the brain cells.
Exactly. So not all the dopaminergic neurons are 80% are dead. Maybe 50% are dead and faultless, but 20-25% maybe they are what? Stunned by inflammation. And then you can wake them up with anti-inflammation, right? The progesterone is anti-inflammatory or antioxidant like glutathione, and then you see that those stunned neurons, they work, and then you see the improvement, instantly improvement, just 1 hour after you're giving the IV.
So what is the dose of the progesterone intranasal? How much gets in?
Well, we know what we give for psychodextrin. We make it 50 milligram per ml because that's how much you can saturate the psychodextrin, right? And we give 2 sprays nostril at night, and I think patients can end up sleeping and boost their 6 hormones and help them with their metabolic syndrome. Metabolic syndrome, everybody above 50, they have metabolic syndrome, right? So what is the answer for that? What will be the best treatment for metabolic syndrome?
Stop eating.
Yeah.
Stop. No carb, that's right, but GLP-1 are good. But the problem with GLP-1, what's the problem? When they shrink the fat tissue, fat toxins come out, and that causes the nausea and rejection, right? Some people, they cannot take it, right? And it causes even organ failure if they are too toxic. So what you need to do, load the GLP-1 inside psychodextrin, and you have 2 birds with 1 stone.
What about small dose metformin?
What's that?
Low dose metformin.
Metformin.
Yes.
Yes.
Low dose.
Yes, let's talk about that. There's something that's called diet capsule that I create, which is made from metformin, amloxanox, naltrexone. If you don't want to give GLP-1, you give them this, and you can add acarbose. The problem with acarbose, it produces gas. You know acarbose, right? It helps absorption. It helps absorption of the carbohydrate, sugar, right, from the gut. But then what would happen to those sugar? They ferment by the bacteria and produce gas. So if you give them anti-gas, that's fine. Some patients, they don't tolerate it. So just give them the 3 if you want, if they have no. Amloxanox itself works like, it helps in lowering the cholesterol and helps in shrinking the fat tissue. Have you heard about amloxanox?
Yeah.
Huh? Okay, it's the trend, and thanks to Dr. Joseph about it. You know, you can treat patients with nonsense mutated genes with amloxanox, like what? Cystic fibrosis. You can make those genes to be expressed again with amloxanox. That's another topic. But also amloxanox is good for obesity, for metabolic syndrome. So the diet capsule made from those 3 things, right? What are the things you need to give the patient?
And let me just chime in too, just so that we don't lose perspective. Is I see when we're talking about losing weight and all these things and Lexanox, and it's not in the absence of exercise, but the reality is that some people are so inflamed, it's difficult for them to exercise, or they're in chronic pain. So you have, again, you have to put everything in context. It's not like, oh, we believe that this is what it is, and that's the answer. It's like, of course, everything that we've been talking about it matters. But we have to also think about situations when people are so inflamed, they're in pain, and they cannot exercise, or they can only exercise so much. This is where we can come in and optimize them and help them move towards the ability to be able to exercise more. So it still comes back down to all the natural things. This is a way of enhancing and optimizing, and so
How
that they
about
can move into
offering
the
low
right direction.
dose LDN, low dose LDN?
Low dose, yeah, naltrexone.
that's
Low dose
another big
naltrexone,
one. Yeah.
metformin,
inflammation.
and amloxanox. You can
Yeah.
add acarbose if the patient has no problem with gas,
Yeah.
right? If they do,
Let's see.
you can give them anti-gas, which is all this. What are the things we have a problems? I'm more or less trying to be practical here. And all this, you can read it, I can send you all that. What are the things you need to know? Spikopathy, right? Do you have problem with spikopathy with your patients? Spikopathy?